What is seminoma in testicular germ cell tumors? Imagine discovering a painless lump in your testicle. That's often how seminoma first shows up. Seminoma is a type of testicular germ cell tumor, which means it originates from the cells responsible for making sperm. It is one of the main types of testicular cancer, making up about 40% of all cases. Although it's considered rare, with about 1 in 62,000 men in Europe developing it each year, it's highly treatable when caught early. Seminoma develops from germ cells that normally mature into sperm during fetal development. Sometimes these cells don't develop properly and start dividing abnormally, forming a tumor. This process begins with a condition called testicular intraepithelial neoplasia, which is like a precursor to the tumor. The exact cause of why germ cells become cancerous isn't fully understood, but certain factors can increase risk. One well-known risk factor is cryptorchidism, which is when a testicle hasn't descended into the scrotum properly. Men who have had surgery to correct this, called orchiopexy, may still have a slightly higher risk. Other factors include a family history of testicular cancer and certain genetic conditions, but most cases happen without a clear cause. Most men notice a painless swelling or lump in the testicle. Sometimes they feel a dull ache or heaviness in the scrotum or lower abdomen. Occasionally, the tumor can cause the testicle to feel uneven or enlarged. In rare cases, men might experience pain, blood in semen, or hormonal changes leading to breast enlargement or tenderness. If the cancer spreads, symptoms can include swollen lymph nodes in the neck, cough, bone pain, or neurological symptoms, depending on where it has spread. Seminoma tends to grow more slowly than other testicular cancers and often stays confined to the testicle for some time. When it spreads, it usually first moves to nearby lymph nodes in the abdomen. Although metastasis is less common than in other cancers, it can reach the lungs, liver, bones, or brain. The good news is that seminoma has an excellent prognosis when diagnosed early. The 5-year survival rate for early-stage disease is very high. Treatment options typically include surgery to remove the affected testicle, followed by careful monitoring or additional therapies if needed. Because of the high cure rate, early detection is key. Regular self-examinations and prompt medical attention, if you notice any changes, can make a big difference. Understanding seminoma within the context of reproductive health is important. While it affects men's reproductive organs, awareness and early action can lead to successful treatment. If you notice any unusual changes or lumps, consult a healthcare professional promptly. Remember, medical advances and early diagnosis make testicular cancer one of the most treatable cancers. Always seek personalized advice from your doctor to determine the best course of action for your health.